My name is Tekpo. I'm the nurse in charge for the Cervical Cancer Prevention and Training Center, Battor, Ghana. This is the Cervical Cancer Prevention and Training Center, and what we do is prevention. So we are more into prevention of cervical cancer. So we vaccinate boys and girls between the ages of 9 to 14 years. We also vaccinate women who test negative for HPV. We also screen using different screening methods like HPV DNA testing, pap smear, mobile colposcopy, visual inspection with an acetic acid. Screening alone cannot reduce the incidence of cervical cancer. So we follow up and also treat. So treatment of positives, women with precancerous lesions. So when I talk about the precancerous lesions, this is what I'm talking about. So HPV causes the precancerous lesions, which later leads to cancer, and this takes a period of about 10 to 15 years. This is the normal cervix. The mouth of the womb is called the cervix. Now, this virus, when acquired by the woman, can be persistent or transient. When it's persistent, it changes the normal cells of the cervix, and this is what it looks like. So we call this acetowhitening. When the woman comes for screening and we are able to detect this, we treat this so that it doesn't get to the stage of cancer. And with treatment, we have different forms of treatment. We have ablative treatment, we have excisional treatment, we have surgery, we have chemoradiation. But we are more into ablative, excisional, and also surgery, because we don't want the woman to get to the stage of cancer. And with the ablative treatment, we have cryotherapy, we have thermal coagulation, we also have the excisional, which is loop electrosurgical excision procedure, we have cold knife conization and other forms of treatment. We also have surgery. Now, talking about the Cervical Cancer Prevention and Training Center, when was it set up? It was set up on 31st May 2017. That was when the center was set up. So the Cervical Cancer Prevention and Training Center was set up on 31st May 2017. And we started training in September.
Yeah, allowed her to come.
Yes.
Then you come.
So 31st May 2017. That was when the center was set up. And as a training center, our aim is to train health workers across Ghana, because we've realized that screening is skewed only in the urban areas. So women in the remote areas do not have access to screening. So this center, one of our mandates is to train health workers. Because of that, we started training in September 2017. And so far, we have trained 258 health workers across the 16 regions in Ghana. Our training is in two modules, Module 1 and Module 2. In Module 1, we teach our trainees the skills, the principles of cervical screening, and how to set up in their various facilities. Because we've realized that screening is not ongoing in every facility, from the CHIPS compound to the district hospitals. Not every facility is screening, and we cannot achieve our target if screening is only skewed in the urban areas. So our tenet or our philosophy as a screening center is task shifting, so training health workers, especially the low or middle cadre health workers, so community health nurses. We are talking about the general nurses, the midwives, so that they can be able to render services. They can bring cervical screening and preventive services to the doorsteps of women. Another philosophy is decentralization. We cannot do it alone. And I mean, women in the peripheries must also get access to screening. So we want to decentralize screening so that women, no matter their geographical location, can get access to screening. Another tenet or philosophy is sustainability. We want this program to be sustainable, because we've realized that most at times there are opportunistic screening or sporadic screening which is not sustainable. They screen the women and that's all. Sometimes they don't even follow up. But we want a system whereby screening will be sustainable. That is why we are training. So we want screening to be sustainable. We want a decentralized system, and we also want middle cadre staff to be able to screen in their facilities. So basically that is what we do here. And apart from the model 1 training, we also have model 2 training, and the modules are every 2 weeks. We train for 2 weeks, for the duration of 2 weeks. So with the model 2, what we do is to teach them on treatment. It's basically on treatment, how to follow up on the positives, because screening alone will not reduce the incidence of cervical cancer, but treatment is also essential. So far we have trained 12 health workers in model 2. Currently we also have training in session. Another group has come for model 2, and we are trying to equip them so that when they go back to their various facilities, they will be able to screen and also treat the women who have precancerous lesions. Cervical screening is not done for boys and men because they do not have the cervix. So it's done for only women from the age of 21 years and above. But vaccination can be given to boys and girls. So boys and girls between the ages of 9 to 14 years can benefit from vaccination. Why do we say so? Because HPV, human papillomavirus, does not cause only cervical cancer. The human papillomavirus can cause other forms of cancer, such as the oropharyngeal cancers or the throat cancers, can cause the penile cancers and also the anal cancers. That is why we vaccinate boys and girls. And when the boys and girls get vaccinated, they are protected. We call something the herd immunity. So they are protected from HPV. And this will mean that when they grow up, they are not going to transmit HPV to their subsequent partners because they are protected against the HPV. We train all categories of health workers. We train doctors, we train physician assistants, we train nurses, we train midwives. And the training is done here at the Cervical Cancer Prevention and Training Center. We have trained health workers in all the regions in Ghana, including 2 nurses from Liberia and 1 doctor from Sierra Leone. Globally, 600,000 women are diagnosed of cervical cancer, and about 340,000 die annually. In Ghana, annually, 3,151 women are diagnosed with cervical cancer, and 2,119 die from the disease. Cervical cancer as a public health problem can be eliminated through intensified vaccination against the human papillomavirus, screening and treatment. So it's very important to vaccinate our boys and girls. Women who test negative for HPV should be vaccinated. It is very relevant to also screen women and also treat precancerous lesions so that they do not get to the stage of cancer. To reduce the incidence of cervical cancer, capacity building is very important. So we appeal to our members of parliament and other stakeholders to help us build capacity by training health workers in our facilities so that they can render services. Apart from that, screening is not covered by the National Health Insurance Scheme. So we appeal to government to include cervical screening into the National Health Insurance Scheme so that every woman can get the opportunity to get screened. Apart from that, we also want government to equip the facilities with our logistics or with cervical cancer screening logistics so that they can be able to render services. Vaccination of boys and girls is also crucial in the elimination of cervical cancer. So our appeal goes to government and other stakeholders to include vaccination against HPV into the vaccination program, the national vaccination program, so that boys and girls can benefit from vaccination. this is the map of Ghana, and this map gives an overview of the towns that are offering cervical cancer screening services. So in these towns, there are health workers that have been trained by the Cervical Cancer Prevention and Training Center and other organizations, but most of the pins shows that the training was done by the Cervical Cancer Prevention and Training Center. Now, the pins are in different colors and it has different meanings. When we look at the red pins, it indicates that one health worker have been trained in that town offering the cervical cancer services. So a town like Mankarigu is having a red pin, then Tamale is also having a red pin. So it means that one health worker have been trained in that town, which is also offering the cervical cancer screening services. The yellow means 2 health workers have been trained in that town. Now, a town like Damango and also Kintampo has yellow pins. So 2 health workers offering cervical screening in that town. Then the blue means 3 health workers have been trained in that town. So a town like Sunyani, we also have Cape Coast here, offering cervical cancer screening services. Then we have the green. The green means that more than 3 health workers have been trained in that town offering cervical cancer screening and prevention services. So a town like, so we have Kumasi here, we also have Sekendi, Takrady offering cervical screening. Apart from the green, we also have the white. The white means that these facilities in the towns are offering cervical cancer screening services, but they are not trained by the Cervical Cancer Prevention and Training Center. So basically, this is what is going on in Ghana, and these are the areas or the towns that are offering cervical cancer screening services that have been trained by the Cervical Cancer Prevention and Training Center, Battor.